In the Northwest Province, adolescent girls as well as young women are experiencing a higher rate of new HIV infections, and recent findings indicate that adolescent orphans are more likely to be HIV positive. And Mohajane Director of HIVSA's Health Systems Strengthening joins us now to take this issue further. Neo, thank you so much for joining us. Good afternoon. Look, what makes these adolescent girls, particularly in that province, and orphans more at risk of contracting HIV? We know there's a lot of information around the pandemic.
Thank you very much, and thank you to your listeners for having me. The Northwest Province has a high prevalence of young people living with HIV, and the population in that particular province is predominantly youthful. We have about 36% of the population that is youthful. Now, of this group, we're estimating that about 14% of those that are living with HIV are young women. They're particularly vulnerable to HIV infection because of issues such as, for instance, child-headed households, the fact that they're made vulnerable by HIV infection, and the fact that they are now, you have children raising themselves. You also have issues related to high unemployment rates. That means that young people, particularly young girls, are then prone to having to look after themselves and look after their siblings. We also have high levels of violence, which is something that cuts across our country for young people in particular. And we also have issues such as substance abuse, binge drinking, multiple sexual partners, particularly what we have come to know as the sugar daddy syndrome. And these are some of the drivers of the epidemic for young people.
But now, shouldn't then social services as well as authorities then kick in when it comes to the issue of child-headed households? As you are saying, there's particularly no parent figure. These kids are literally raising themselves.
We know that our social services are particularly burdened, especially with the amount of funding that is provided to community-based organizations for them to be able to care for children that are vulnerable to HIV infection for one reason or another. And we know that the support that we receive, for instance, from the United States Agency for International Development, USAID, helps to bridge the gaps in funding so that we're able to then provide more assistance to the organizations that are providing, support to young people to ensure that they also are able to be capacitated to stay in school, for instance, because if they are not completing school, then it makes them even more vulnerable.
So with this in mind, then I mean, how close would you say we are from the UNAIDS 959595 targets?
I think, for instance, to give you just a snapshot, in Gauteng, for instance, we know that 86% of the people that are living with HIV know their HIV status, and we know that 77%, about 78% are linked into care, and about 84% of those that are linked into care are virally suppressed. So we're still far off in terms of reaching the 95 imperatives, and it's important for us to close those gaps as closely as we can. So where the gap currently is particularly around ensuring that those that are HIV positive get to the second 95, which is being on treatment and then staying on treatment and becoming virally suppressed.
And in closing, Neo, you recently received a significant grant from the United States Agency for International Development under the U.S. President's Emergency Plan for AIDS Relief. So talk to us about that grant. What are the key objectives of this program, and how many people do you think it's going to reach at this stage?
So this program, is focusing on children, adolescents, and families in the HIV epidemic in the Northwest Province. And the objectives are to work with community-based organizations to build local capacity to ensure that organizations that are providing support are sustainable. It is aimed at ensuring that we work as well with local civil society structures as well as departmental structures that are supporting this to build the partnerships and the relationships that will help us to be able to ensure that where there are children that are identified as living with HIV, that they are referred on to other structures that will support them with clinical interventions. For instance, any clinical partners that are providing care and support in those areas, or those that are able to link them into clinics for treatment. Mm-hmm. So what is important for us at this particular point is to ensure that working with all of the partners that are already in those in the province, mm-hmm. that we are ensuring that the adolescents and young people receive comprehensive packages of preventative services, as well as ensuring that the families, where there's family structures, those are strengthened to be able to meet the needs of the young people in the province.
All right.
So this is a 5-year grant, and in that period, we hope to be able to reach as many children as we possibly can. It is going to be implemented in 3 districts of the Northwest Province, in Ngagamadiri-Malema, in Dr. Kenneth Kaunda, as well as in Bujanala.
No, thank you so much.
And these are the districts that are hardest hit.
Awesome stuff. Thank you so much for your update there. That is Neo Mohajane, the Director of HIVSA Health Systems Strengthening. And we were talking about the scourge of young girls as well as orphaned children being at risk of contracting HIV out in the Northwest Province.